Hello, soon-to-be licensed nurse practitioners, Miss Cohen here, and today we're going to be going over this blog on screening guidelines, a very important topic, not only as student nurse practitioners preparing yourselves for the exam, but this is something you're going to be utilizing when you become a practitioner in practice. So let me show you what we're going to discuss. Where do guidelines come from? How to read the USPSTF, and I'll tell you what that's about. And for screenings, I'm going to be going over mammograms, colonoscopy, and cervical as examples, but there's many more. Where do guidelines come from? The U.S. Preventative Service Task Force provides guidance to clinicians and patients on effective preventative care. Evidence-based recommendations about clinical preventative services such as screenings. Also, they talk about counseling services, preventive medications. It was created in 1984, and it is an independent volunteer panel of national experts in prevention and evidence-based medicine. Now, I'm sure you've heard of other guidelines and screenings. Just to give you an example of other screening recommendations or guidelines that you may have heard of, one of them is the GINA guidelines for asthma. How about the hypertension guidelines, the American Academy of Family Physicians? That's that JNC8, remember that one? Then you have, for example, American Cancer Society, which talks about cancer screening guidelines. You have the Center of Disease Control and Prevention, the CDC. You have cancer screenings like National Comprehensive Cancer Network, the NCCN, American Congress of Obstetricians and Gynecologists, the ACOG. Dermatology has one, such as the American Academy of Dermatology. Dentist has one, American Dental Association. But what I want to bring to your attention is that there may be multiple sources where you get your recommendations from. And for the most part, they're very similar. But for the purposes of the exam, I point out the guidelines that you should be following, such as, for example, the hypertension. We use the JNC8 from the American Academy of Family Physicians. But know that there are other sources that talk about the guidelines. None of them will contradict themselves, but know that there's multiple sources for a specific topic, such as like the cancer one, right? We have the CDC and the NCCN. Okay, so I just wanted to throw that out there. But today we're going to be focusing on the USPSTF guidelines. So how to read the USPSTF? It is a signed recommendation via a letter grade, A, B, C, or D. The letter grades are based on strength of the evidence and the balance of benefits and harms. So you'll see that I am a big color coordinator for visual learning purposes. The green is strongly recommended for A, but letter B is also recommended, and you'll see that we follow both. But A is strongly recommended. Now, C is no recommendation. I'll talk a little bit more about that. D is not recommended, and I is insufficient evidence. A and B offer the service. C only if other considerations support the offering or providing the service. An individual patient will benefit that patient. So you have to outweigh the risk, the benefits, and it's more of an individualized case scenario. D, definitely discourage the use of the service. Okay, recommendations are either published or in progress. When you go on the website, you'll see that. Now, examples of A's would be colorectal cancer screening, hepatitis B in pregnancy, cervical screening for women aged between 21 and 65 every 3 years, just to give you an example, but there's a long list. And this is how it looks like when you go on the website, how to read the USPSTF. Here directly it shows you what A, B, C, D, and I mean. But I already color coordinated for you, so now you have a better understanding. So let me show you an example. Let's practice by looking at mammogram screening recommendations. Mammogram screening recommendations, grade B, for women aged 50 through 74. Biannual screening. Now, keep in mind that guidelines change. And in the Cohen review, I am constantly updating my material so that it's most up to date with the guidelines that are recommended. But please be mindful that it is your responsibility to look up guidelines constantly during practice to make sure that you are up to date with what is recommended. Back to mammogram screenings. Grade C for women aged 40 to 49. You would start screening before the age of 50 if there's an individual decision, such as like a high risk breast cancer, such as, let's say, family members, such as the mom, close relatives like mom had breast cancer, then this particular individual will be considered high risk for breast cancer. In that case, in that particular case, you would want to start screening at age 40 instead of 50. And you can read more about this by logging in directly into the website. I have the link there available for you, but I made a copy from the website as to what it looks like. And you'll see that NB is highlighted in green and is what we're following. But if you feel that the patient is high risk, then you can start sooner. Let's look into colonoscopy. So colonoscopy screening recommendations, you'll see that we have grade A, so absolutely recommended for adults aged between 50 and 75. Grade B, also recommended for adults aged 45 through 49, but there's something called an average risk calculator, which is created by the NIH, which is the National Cancer Institute. And things that this calculator will ask include if the patient is from Hispanic descent, sex, age, height and weight, servings of vegetables, physical activity versus vigorous activity, history of colonoscopy, medications that contain aspirin versus NSAIDs, family history of colon cancer, and such. And it puts all of this together and it gives you a score. If the score is on the higher end, then perhaps you would consider starting at the age of 45. All right, it's just an extra tool. But both, remember, grade A and B is recommended to start colonoscopy. Grade C is for adults aged between 76 and 85. This is something you want to discuss with the patient. Consider overall health, life expectancy, comorbid conditions, prior screening histories, preferences, and such. And here is what it looks like directly from the website. Grade A, B, and C, and the recommendations. Let's look at cervical screening. Grade A for women aged 21 to 65, every 3 years. And I know what you're thinking. You're probably still seeing that GYNs are doing yearly screenings. Now, I don't know why. It could be it's old habit. It could be because it's still covered by insurance. I have no idea. But the recommendation is every 3 years. It is a grade D, not recommended, for less than age 21 if the patient has had a hysterectomy or if the patient is over the age of 65. And you can read specifically description as presented by the website itself. Screening for NP boards. Now, guidelines are updated frequently. There are multiple sources to follow for guidelines. Each institution will favor a specific clinical practice guideline. The Cohen Review highlights what guidelines you need to follow for NP boards. Ladies and gentlemen, I hope that this was helpful, not only for the purposes of the nurse practitioner boards, but also for when you become a licensed practitioner and you're into practice. Go into these links, go into the websites, learn how to read them, become familiar with them, and be up to date. It's my best recommendation when it comes to guidelines. Best of luck, guys, and thank you for watching.